So here we go, we're going to start our next part of planning the surgical treatment zone. So you can see all here is the lighter, whiter gray is our transition zone. That's the BPH. All of that is compressing. What we see the number 2 here, that's our urethra where our scope is. Just beneath it is our peripheral zone. That's where if we have prostate cancer, why we do rectal exams, that's the zone most cancers occur. So the upper portion, the Canada of North America, is our transition zone. We want to treat all that. So we're going to go ahead now and move all of our cursors down to create up to a 2.5 centimeter defect radius. So again, if you do that on a half circle or a circle, that's up to a 5 centimeter defect we're going to be able to create in the center of the prostate, allowing this gentleman to get off his medications he's been taking for many years, nearing retention, getting infections. So really we want to de-obstruct him. And you can see here we can create up to even beyond 180 degree rotation of that water bead. So here we're going to mark that plane. And now we'll take it into the other axis once we've created what we want to treat, from a coronal view now to a sagittal view. So now we're looking in axis with our scope. There's our scope, there's our sheath, there's our prostate, and that's the bladder right now. So we're going to go ahead and design our next steps. So now we've changed the ultrasound to the sagittal view so we can see our prostate with a median lobe, a little protrusion into the bladder. There's our sheath, the axis of our sheath. That's where our camera is situated. So we can see here on the camera, this is we're parked at the sphincter. We're parked at the site where we can get incontinence or ejaculatory dysfunction, so we know where not to treat. So we have that visual cue here, our sheath. Now we're going to go ahead and do our designing of our treatment. First, we'll go ahead and press the pedal. We can see the beam where the water is being shot out. We can tell the robot where that's situated. Check again. So we'd see that imprint on the adenoma and gives us a better access of where treatment start point will be. And then we'll go ahead and tell the system, our computer robotic system, where our treatment zones will be, where we want to start, where we want to go for the bladder neck, the deepest portion. Again, you can see the separation. This is transition zone, that's peripheral zone, that's our surgical capsule. If we want to get close to as possible, we'll probably get deeper on the second pass. The robot will then communicate with us what would suggest a treatment plan. And as you can see here in the orange, that's what's called the butterfly cuts. That's the area where we won't be treating underneath toward the ejaculatory system. What's called the butterfly cut. That's the novel technology here to preserve sexual and ejaculatory function in well over 90% of patients. We're ready to go. Let's get started with aquablation first pass.
Yeah, stuff.